My name's Christy Lonning. I'm getting ready to turn 49 this summer. I live in St. James with my husband, and we have 4 children. 2 are grown and out of the house, and we have 2 boys still living at home. They go to school here in Rolla. I teach with the Rolla Public Schools, 1st grade over at Truman Elementary. I noticed that I had a lot of tenderness and just a lot of discomfort in my left foot. It's kind of hard to go back to when it really started because, you know, when you are over 40, your body just isn't like it was when you were 20. As I started realizing, okay, this is like a daily thing, then I started noticing other things that I thought maybe were related, like I had pain in my leg. Riding in a car for more than like 30 minutes or an hour became really uncomfortable. I had a lot of discomfort, even way up into my hip. My daughter used to compete in gymnastics, so we knew Dr. Pearson. His daughter and my daughter were on the same team for 7 or 8 years, so we knew him just on a personal level. But when I realized I was going to need to go see someone, I just made a simple Facebook post and I kind of explained, like, I wasn't even sure if there was something I could do at home or something that maybe I should stop doing. Like, I love to wear flip-flops. I love to wear, you know, cute shoes every now and then. And I was thinking someone will just tell me, you know, well, that's the first thing you've got to change. But when I made the post and I explained what I was going through, one of the Phelps health employees reached out and said that she said, I work in the office where Dr. Pearson's at. We would love to help you. She was wonderful about getting me in. It worked great because she knew, being a teacher, you know, getting a substitute was really hard, so she got me in during my Christmas break. Believe it or not, when I made that post about who would you recommend, many people said Dr. Pearson, which was good for me because I knew Dr. Pearson on a personal level, and I thought, okay, well, this is perfect. Everybody has just really been outgoing and friendly and willing to go above to help me. For example, I had to change one of my appointments. One of the days I had an appointment scheduled, we had some weather. I called and they're like, that's no problem. When can you come? They got me in earlier. So, I mean, just the ease of being able to work with the staff and them being able to accommodate an appointment time that allows me not to have to miss work. Like, I would say I'm about 85% pain-free, back to normal. In just a short amount of time, for like not knowing that I don't have to do surgery. I'd also had someone reach out and say, if there's any treatments you can do besides surgery, do that, because the surgery is really tough. Surgery just wasn't the first thing he said we should do. We tried a lot of things before it got to that because, well, that's better for me, you know, me personally and financially. I would totally encourage anybody, if you're in pain and, you know, you just want to get an opinion or get some answers, it's well worth to go, you know, get things checked out, because you don't have to be in pain and you don't have to live that daily life of just accepting, you know, this is how it's going to be.